Hi, all. Thanks so much for joining. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apurv Gupta, and we're talking about our interview with Dalia Haroune, who is the president of Intersect Health. And Intersect Health helps healthcare organizations improve prevention, early intervention, and access to care. And our interview centered a lot around physician burnout, which is apparently one of the key ways to help, a starting point to help address some of these other issues, because there are so many asks of the physician. Everybody agrees that the physician should be helping to lead the charge for what do patients need, what works, how are we going to help them in the best way, but it puts more on them. So whether it's asking them to do, more documenting or coming up with a new process or doing whatever, there's just so much that it's tough for them to handle. So she talked a lot about how they're going in there and aligning incentives for the physicians to help them do the work that they want. That was one thing that stood out to me, because I think it's maybe a natural inclination for people to assume that everybody just wants to move up the chain in a certain manner and wants to manage a team and be the head of a department. But some doctors may not want to do that. They may feel that they're thriving where they're actually interacting with patients on a day-to-day basis. And so it went back to, as so many of our interviews do, to communication and the human aspect. Apurv, what stood out to you?
I think I agree with you, Stephanie. The central points are still the same. The theme is the person in the middle. It's actually intriguing to me because, as you know, Dalia and I were colleagues. She's a consultant just like me. That's what she's doing now, although in a more innovative capacity. And she's trying to deliver better outcomes at the patient end, right? What she calls essentially a version of population health. She's trying to get better care, better quality, better access for patients, and she recognizes that the physician is in the middle of all of that, trying to deliver that. Yet, if you're starting with a group of physicians that are already feeling overworked, overwhelmed, feeling like more and more mandate is coming down on them, and that they've got such a huge burden on them for documentation and follow-ups, that it's going to be really hard for them to actually focus on what you're asking them to do and to thereby be a part of the change and to deliver good outcomes. So I really like all of the points that she's trying to connect together at Intersect Health. I think it is really critical. In our field, we've definitely recognized and seen that burnout, unfortunately, has been growing over decades. And over the past year and a half with COVID, it's really become a major emergency, really a public health crisis for not just physicians, but also nurses and other leaders and other clinicians. So it's very important to recognize that out of the gate. How do we work better with the clinicians? How can we ease their burden? How can we make their work day more meaningful and more enjoyable for them? Something that they're not dreading when they're waking up in the morning, but actually looking forward to. And when you boil it all down, it comes back to what you said in your opening spiel, which is simply you've got to improve the communication, you've got to improve the collaboration. These are the day-to-day issues that are really plaguing the healthcare system, that really wear and tear on our physicians, and ultimately those are the issues that we've got to be able to address if we're expecting better outcomes. So I think I said something similar to what you said. To me, it feels like the same issue, and it's really important to recognize that that's the central issue as we're trying to figure out how to solve our healthcare challenges.
Absolutely. And I thought she really shared a lot of innovative ideas about how to make change and that meaningful change for everybody. And so stay tuned for that full interview on Thursday, and we'll talk to you soon. Bye-bye.
Bye-bye.